Why wait to earn the degree you deserve? You have the experience, you have the knowledge. Now's the time to get the credit for the work you've done and earn the recognition you deserve by starting your comeback at Purdue Global. It's time to earn a degree you'll be proud of, a degree that employers will respect. It's never too late. Never too late to come back stronger and move forward in your career. Start your comeback today at purdueglobal.edu. Purdue's online university for working adults.
This episode is brought to you by Navy Federal Credit Union. It's a special thing to be a member of Navy Federal because they are a member-owned, not-for-profit credit union that invests in its members with amazing rates and low fees. That's why members could earn and save more every year. Plus, they serve all branches of the armed forces, veterans, and their families. So if you're interested in becoming a member, learn more at NavyFederal.org. At Navy Federal Credit Union, our members are the mission. Insured by NCUA.
Episode 358, Our Experiences with Healthcare Sharing.
Welcome to the Frugal Friends podcast, where you'll learn to save money, embrace simplicity, and live a richer life. Here are your hosts, Jen and Jill.
Welcome to the Frugal Friends podcast. My name is Jen.
My name is Jill.
And we are rounding out November, better late than never, with our annual health insurance adjacent episode. And this one is not about insurance. It's about healthcare sharing because Jill and I both use healthcare sharing as we are self-employed, employed by ourselves, and our bosses refuse to get a company health insurance plan. It's us. We refuse. So we're going to talk about our experiences. We've actually used them. We don't just pay for them and not use them. We have used them, and we're going to look at some articles, talk about our experience, and see if maybe it's something you might be interested in using.
But first, this episode is brought to you by the nice kid at recess. They always noticed that you weren't picked for any of the games, like literally zero.
This seems personal.
They waited for you to tie your shoe and walked with you to the nurse's office after you got hit with every single ball on the playground straight to the face, one after the other. And they knew that sharing was caring. And today, we are being the nice kid at recess, not just by sharing, but by giving away $1,000. You heard that right. We're giving one lucky Frugal Friends listener $1,000 real USD to spend on whatever you want. Ideally, it's going to be treating yourself. So head to frugalfriendspodcast.com/pamper, like when you pamper yourself, PAMPER, to enter the giveaway.
If you can dodge a wrench, you can dodge a ball. If you can't dodge a wrench, you can also not dodge a ball, and they all come flying at you. And I
every single time, straight to the face. I wouldn't even be playing the games. I'd be somewhere else on the playground. Boom. Ball to the head.
And then you also get hit by a wrench for some reason. So it's just chaos. So $1,000, we're going to give that to you. Mm-hmm. One person, one lucky person.
You'll get picked by the nice kid at recess.
Mm-hmm. Maybe not for $1,000, but you can always try. And even if you don't want $1,000, because we know some people do not want $1,000, entering the giveaway helps us create more giveaways in the future, maybe of things that you will like. So frugalfriendspodcast.com/pamper. So our annual health insurance, if you want one that's more on the topic of open enrollment, check out the episode we did last year with our friend Eileen Doherty. It is episode 254, How to Save Money on Health Insurance, Open Enrollment Explained. So she talks a little bit more about how you can make open enrollment decisions and save money without sacrificing the level of insurance that you need. And then we also have episode 230, Negotiating Medical Bills with Dr. Virgie Bright Ellington. We just talked about that on our last episode. This is such this is an episode we personally recommend to so many of our friends. It is, and our bill of the week last episode, she saved, what was it? She saved 90% on her hospital bill, brought from like $800 to $90 using what she learned in episode 230. So definitely episodes to queue up for after this one. But we want to talk about our experiences with healthcare sharing ministries. If you are not sure what a healthcare sharing ministry is, it is an alternative to health insurance where people pay into a quote unquote monthly share, and it's paid into a pot, and people will share medical expenses with the group. So very similar, but not it. So we'll talk about some of the similarities and differences as we go through.
Mm-hmm. So this first article comes from UHSM, and it's titled 4 Key Differences Between Health Share Ministries and Health Insurance. So I think as we go through this, we will get a sense for just what are health share ministries and how do they differ, which even with having a health share ministry to address our medical expenses, I even learned a lot going through this article.
Mm-hmm. Yeah. Okay. So we're going to go through all of these. The first key difference, and this is probably a little more biased towards healthcare sharing ministries because it's from United Healthcare Sharing Ministries. But the first is affordability. So we all know health insurance plans are very expensive. Honestly, that's the primary reason most people choose healthcare sharing is for the affordability. So health insurance plans have been increasing. In 2019, the annual premiums for health insurance for a household with 4 cost $20,000. And those costs don't even include out-of-pocket expenses that health insurance policyholders have to cover on their own. Members of health share ministries, however, they pay a lot less. They can save as much as 50% compared to traditional health insurance plans. So that's the main reason, honestly, for choosing healthcare sharing. And we definitely, that's the reason both Jill and I are on these healthcare sharing ministries, because we just, counted the costs and it was more affordable. But I will say, I'm the only one in my family of 4 on a healthcare sharing plan. My husband and 2 children are both on his insurance. And so what we looked at the cost of having all of us on his insurance, and it was more affordable and with the amount of times our kids need to go to the doctor, we calculated the cost, the average, and found that it's more beneficial us to have insurance for the kids. And so if we're going to have insurance for the kids, we've got to have it for Travis too. But we save money by like a couple $100 a month just by me being on the healthcare sharing and them being on insurance. So it's not an either or. It can be just kind of a hybrid. It's up to you to figure that out. And hopefully this episode will help you do that.
Yeah, they referenced too in here, even before getting into the 4 main differences, that there's this pocket of society within the U.S. of those who certainly earn well over the federal poverty limit, but still fall short of being what they might call, quote unquote, financially comfortable. And so for those who are choosing regular insurance options, sometimes healthcare can represent a significant portion of the family budget each month. And so, yeah, that's where these healthcare sharing ministries come into play and can be helpful just regarding affordability month to month, and sometimes with the out-of-pocket expenses. So then number 2, as far as main differences go, is organizational aim, meaning what is a health insurance company's organizational aim versus a health share ministry's organizational aim. And for typical health insurance companies, they are for-profit organizations. So they are going to charge premiums for policies in order to make money. That's just how they function. That's how most businesses function. You're going to have some degree of markup to be profitable. And so we, the consumers, are going to be the ones who pay for that if we're going the traditional health insurance route. Whereas for healthcare sharing ministries, they are nonprofits. So contributions are collected in order to cover medical expenses for the members. It all kind of goes into a pool and a pot and is distributed amongst members. So you're not paying as much for some of that profitability of the organization, but rather sharing medical costs of those involved within that community. So very different, of course, how a nonprofit versus a for-profit might be set up.
Mm-hmm. The third is eligibility and payment of medical expenses. And so this is the main driver away from these programs. So health insurance programs are bound or were kind of iffy, bound by mandates, which dictate that all individuals must be accepted into plans, including those in poor health, pre-existing conditions. Health share ministries, on the other hand, are not mandated by that. So membership eligibility is based on the standards that a particular ministry outlines, and each program has different standards. So even if you don't qualify for one, that doesn't mean you won't qualify for any of them. But in this way, health share ministry members don't have to pool their contributions in an insurance pool that doesn't choose its members based on lifestyle or health levels, and they have the freedom to share the cost of medical care with other like-minded individuals. So one of the main of these eligibility things is signing a statement of faith for a lot of, not all, but most of them. And so you have to sign a statement that you agree with the faith, like, foundation of the, quote unquote ministry. And so, we're comfortable in doing that. I'm pretty sure that the one I'm on, Liberty, doesn't require you to have the same faith. It just requires you to accept that the nonprofit, the ministry, operates from that statement of faith. So I like that about Liberty. But so that is a primary barrier, but also the lifestyle agreements. You have to agree to live a certain lifestyle. So, and it's different again for every program, but there's usually, you have to fill out a questionnaire about like smoking, drinking, all recreational drugs, just kind of agreeing that you won't do anything illegal. So if you're prone to illegal activity, this isn't going to be the best route for you.
But what that also means is that some medical expenses that are directly connected to those lifestyles would not be covered or available for sharing out of the pool. So for instance, if it is said that maybe lung issues that you're having are directly related to cigarette smoking, and they're saying we don't cover things related to lifestyles of tobacco use, then it's not going to be covered. So this is definitely I think one of the biggest barriers for some people in choosing healthcare sharing ministries, that eligibility requirements or willingness to sign these different statements or agreements to lifestyle can be quite prohibitive to some. Whereas for others, it's the affordability is the biggest priority. And so some of these other things you might be willing to adhere to in order to save the amount of money. So definitely pros and cons. And that third one's certainly a big one.
Mm-hmm.
The last one on this list of the big differences between the two options is flexibility with available medical professionals. So for health insurance, typical health insurance companies, usually in an effort to keep costs as low as possible on their side, they will restrict the choice of physicians and hospitals that policyholders can visit. Probably many of you are familiar with the rigmarole of maybe needing to change insurance and then possibly change doctors and call around to see who's in network and who's out of network and where can I go and where can't I go. And they may place limits on the types of medications that are made available, whereas health share ministries often do not place such restrictions on the type of doctor or specialist that members can visit. So that's something to keep in mind as well. I will say from my experience, there is still a version of an in-network, out-of-network. It doesn't preclude me from being able to visit whoever I want. There just might be increased savings if I were to choose a doctor or office or hospital that is termed, kind of within, I don't know if they even use that exact language, but essentially within network. Still, I can choose wherever I want to go. I just might not see the same amount of savings.
Mm-hmm. Yeah. So as we get kind of more into revealing our stories, we'll go into this next article from GoodRx. And it's called What is a Medical Cost Sharing Program? But we really want to talk in this one about what questions should you ask before you join a medical cost sharing plan. And so the first part of the article kind of covers what we already went through, but I will add this stat that more than 1.5 million Americans are members of these religion-based cost-sharing groups. So this isn't just a fringe, group of people. There are a lot of people on these programs. They do what they say, what they claim to do. And so this is something that is a possibility for you to look into if you don't have a lot of medical concerns, a lot of reasons you go to the doctor. That's probably the biggest, if I had a chronic health condition that I was going to the doctor for regularly, I may be a little more hesitant. But I used this for my second pregnancy. I was on healthcare sharing. I had no insurance. And obviously going to the doctor a lot. And there were some frustrations, but in the end, it was a very painless experience to use this. I think it was about as painful as using insurance for my first birth. So I don't think it's any harder to use healthcare sharing. But that was like a season in my life. If healthcare is something that you are dealing with constantly, then this is going to be a harder decision for you. But so we want to go through those questions you should ask if you are thinking about it.
AI might be the most important new computer technology ever. It's storming every industry, and literally billions of dollars are being invested. So buckle up. The problem is that AI needs a lot of speed and processing power. So how do you compete without costs spiraling out of control? It's time to upgrade to the next generation of the cloud, Oracle Cloud Infrastructure, or OCI. OCI is a single platform for your infrastructure, database, application development, and AI needs. OCI has 4 to 8 times the bandwidth of other clouds, offers one consistent price instead of variable regional pricing. And of course, nobody does data better than Oracle. So now you can train your AI models at twice the speed and less than half the cost of other clouds. If you want to do more and spend less, like Uber, 8x8, and Databricks Mosaic, take a free test drive of OCI at oracle.com/strategic. That's oracle.com/strategic. oracle.com/strategic.
We know New Year's resolutions often don't stick. In fact, on average, they last around 30 days. So if saving money is on your 2024 resolution list, here's a foolproof way to stick to yours.
Switch your phone provider to Mint Mobile. For a limited time, wireless plans from Mint Mobile are $15 a month when you purchase a 3-month plan. That's unlimited talk, text, and data for $15 a month.
For those of you paying close to $40 a month for just one phone line, this means a savings of $300 over the course of the year. We especially like Mint because all plans come with unlimited talk and text and high-speed data delivered on the nation's largest 5G network.
To get this new customer offer and your new 3-month unlimited wireless plan for just $15 a month, go to mintmobile.com/frugal. That's mintmobile.com/frugal. Cut your wireless bill to $15 a month at mintmobile.com/frugal. Additional taxes, fees, and restrictions apply. See Mint Mobile for details.
And the first one is, well, the first one on this list is what are they? But we kind of already covered that. So maybe we'll go into the second one, Jill.
Yeah. So an important question to ask is, can medical cost sharing be a better option than health insurance? Of course, the answer is ultimately going to be individualized. But as you ask this question, you can kind of look at the pros and cons of both, what's going to fit for you. So those who are in support of medical cost sharing are often attracted by the lower monthly payments. So these programs typically call them share amounts, very similar to a premium that you might pay with a regular insurance. So those monthly costs can be $100 or less for a single person. By contrast, a bronze level plan from the health insurance marketplace averages about $330 a month for that same one person. There, of course, are some government subsidies available that can bring that cost lower. But if you were just to compare them at face value, one is at least double, if not more, as far as insurance goes from these monthly share costs. And that's not to then talk about other out-of-pocket expenses. And so these cost-sharing plans can often get lower prices on treatment because the plans or their members pay healthcare providers directly, which does allow a lot more room for a different pricing structure with the healthcare providers or hospitals. And additionally, some of the healthcare sharing plans will cover some things that regular insurance does not. Examples of this include medical treatment overseas, if that's needed, funeral costs, sometimes even adoption expenses at certain tiers and with certain types of healthcare sharing. So I think it really is going to depend on what types of coverage do you need, what is your biggest priority in considering whether medical cost sharing is better for you than health insurance. On the flip side, of course, medical cost sharing lacks some of the safeguards of regular health insurance, but it still can work for some people.
Mm-hmm. So I have pulled up my plan. So I just want to, since we're talking about costs, I do not know what your health insurance costs. I can't tell you how it compares, but I can tell you what I am paying and what I'm paying for. And just, out of this one healthcare sharing company or nonprofit, and you can start to compare. So I am personally with Liberty Health Share. Jill, which one are you on?
MediShare,
yes. And I have been on Christian Healthcare Ministries in the way back. So this is I got free health insurance when I was employed, so I stopped that one, and then when I left that job, went on to Liberty. So I am on the highest tier of Liberty. So there's 3 tiers. Well, there's technically 5, but one is for people on Medicare 65 plus, and the other one is for like 18 to 29-year-olds. And so I am on the highest tier of the one that I qualify for. And they actually break it down by age too. So if you're under 35, so basically 30 to 35, you get, or 30 to 34, you get one price, 35 to 49 gets a higher price, and then 50 plus gets a higher price up until 65, that higher tier. And I'm on the most expensive tier. I am 34 years old, so I pay $259 a month. My AUA, which is my annual unshared amount. This would be similar to, I guess, a deductible. And I will never, insurance terms are the one thing I will always confuse. I will never master. I will always have to Google. I'm a really bad personal finance expert when it comes to insurance. I'm so sorry. But so my annual unshared amount is $1,000. Anything after $1,000 is up to $1 million per incident is completely shared. That's what's on the highest tier. I chose that one because I knew I was going to get pregnant. You have to be on it for at least, I think it's 6 to 10 months, depending on the program, before you can get pregnant and have that pregnancy covered. So, which I was more than fine with because I've been on it for several years. But I chose into this one specifically at a time when I was like, I think I'm going to get pregnant in the future. I'm going to choose this one now so I have the right amount. And I didn't even get my birth control taken out until it was, 6 months into this current program. But they have two other lower ones. So the next lower one has the same annual unshared amount of $1,000. And then it is there is a co-share of 15% after the AUA has been met. And then the lowest one, the AUA, is $4,000 per year. And there's a 25% co-share. But that one, if I was on that one, I'd be paying $159 a month versus the $259. So it's like $50 increments per month higher. And it's a little higher, if you're a couple or family, but still a lot better. So we are on a fairly low level, high deductible plan for Travis and the kids. And it was still cheaper for me to be on here. I think it was going to be an extra $400 or $500 a month to put me on the insurance. And instead, I'm over here paying $259 per month. So even if the person who's not owning the insurance policy maybe wants to look into getting onto healthcare sharing, that might be a way to save a couple $100 a month is by kind of doing the hybrid that we're doing.
Yeah. Yeah. Whereas Eric and I pay right about $200 a month for the both of us, but we have a very high, what is similar to a deductible. They don't call it that in the healthcare sharing world, but the deductible, what you would have to pay out of pocket before they start covering your expenses. We chose the $10,000 deductible, and that just has helped to dictate what is in our emergency fund. And certainly chose that during a time when we just did not have the money to spend more than $200 a month towards this, and we're not going to the doctor hardly ever. So that's what worked for us.
Mm-hmm. So the next question you need to ask before joining a healthcare sharing program is, what risks are associated? So unlike health insurance, the legal system can't force these programs to pay members' medical bills. But honestly, even in health insurance, it's very hard to get them to pay for some medical bills. But state governments have no control over healthcare sharing. In fact, 30 states have laws saying these plans are not bound by insurance company rules. Insurance watchdogs in at least 15 states have warned people to be careful with these plans. But these are, insurance. These are insurance people, insurance experts. And they say the insurance department can't assist you with any complaints about a healthcare sharing ministry. So you do need to read the book. They have a book that it's a very thick magazine for us. And it tells you all the things they cover, the things they won't cover. All of this, you got to know all of this stuff before you sign up. There are time restrictions, like with the pregnancy thing. Liberty covered 100% of everything for my pregnancy after the AUA and covered it as one considered it one expense. And so we got but I had to submit all of my claims for my pregnancy within 6 months of the birth. So there's a time limit on when you could submit medical bills. It has to be within 6 months of the date of service. And if it's after, they will not cover it. And that's, again, I only speak for Liberty. So yeah, and I think the only bad thing, so sometimes I think the biggest reason we chose Liberty was because they would pay the provider directly. Some of these require you to pay the provider and they reimburse you. But I knew for a pregnancy, I was going to have a hospital stay. And lo and behold, I got a $72,000 bill from my hospital for my C-section and 3-day stay. That is a expensive hotel stay.
That is expensive.
Right. And I couldn't pay that and have somebody reimburse me. No way. So I submitted it to Liberty as soon as I got it, and they paid the provider directly. Some of them, they paid me. I overpaid my AUA, and they reimbursed me. So all that. But then there was one snafu where I called and I thought they had paid the provider, but they had actually paid me. So I'm like getting letters that I'm in collections. And I'm like, but they said they paid it. And so I called again and I missed on the thing where it said it was paid, but it was paid to member. So I'd gotten a bunch of checks for overpaying my AUA, and I didn't know what they were all for. I had a newborn. I just deposited the checks and, was like, yay, money. And so that happened. That's what it was. And so I am right now in collections. I have to pay this bill. That just happened yesterday. But yeah, so they were very diligent in paying me, reimbursing me. Literally, I submitted that $72,000 expense. And within a week, I logged back in to the portal and it was zeroed out. So that was fantastic, very seamless. I think the biggest problem I had was with my doctor's office that I wanted them. I was like, you can bill the provider. You can bill the healthcare sharing. And they were like, no, we can't. And I was like, yes, you can. And they were like, okay, we will. And I was like, cool. And they were like, nope, just kidding. And then I was like, okay, I'll do it. And so I'm thinking I have to submit all these expenses. And in the meantime, they're submitting them too. So and that's another thing I found out when I was on this call, was it like yesterday or 2 days ago, that I had double sent in some bills because the doctor's office was sending them when I didn't know they were sending them. So it can be confusing for some doctor's offices to figure out what to do with people on healthcare sharing. Is it annoying? Yes. Was it a deal breaker? No, because the things got paid. If they weren't going to do it, I could do it. And, Liberty would pay it. I didn't have to pay $72,000 out of pocket. But so depending on which one you go to, having to pay out of pocket is a risk. And sometimes there's limits on how many doctor visits they'll cover, the amount of coverage. So if I go in and the cost is under $200, they don't cover it, no matter what it is. If it's under $200, they don't cover it. Don't don't submit it. So some stuff like that. So you just have to read the book and see and compare these programs before you go with one.
Which goes to the next question. Do medical cost sharing plans cover all conditions? And the answer is no. They're not required to cover everything. And that's one of the reasons that they do cost less than regular health insurance. But these plans are not bound by the Affordable Care Act rules. So they do not have to cover pre-existing conditions. And they are also not bound, or that they can be exempt from having to cover the ACA's top 10 essential health benefits, which are ambulatory patient services, emergency services, pregnancy, maternity, and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative services and devices, laboratory services, preventative and wellness services, and pediatric services. Now, that doesn't mean that they do not cover these things. It just means that they don't have to. And that's where reading that book that Jen is describing, meaning the book that these healthcare sharing plans will give you, outlining what will we cover, what will we not cover. That's going to help you determine, is this going to be the right option for you? Knowing what are you currently dealing with? What might you be dealing with in the future? What are you certain you want them to cover? What do you not care about? Are there aspects that they aren't going to cover that don't pertain to you? So that's no problem. So it's just worth noting that they're not bound to cover these things, but it doesn't mean that they won't.
Yeah. So I was just looking up kind of like, what is the ambulance policy for Liberty? And so they have the right to dictate what is emergency and non-emergency. So expenses resulting from transportation by ambulance for conditions that will not seriously jeopardize the sharing member's health or life are not eligible for sharing. But if it is deemed, seriously jeopardizing to their life, those travel things can be eligible for sharing. So, and any additional expenses for transportation to a facility, not the nearest facility capable of providing medically necessary care, are not eligible for sharing. So, again, you should be reading these things when you have insurance, right? You have to know which providers are in network, which are not, which hospitals are in network, which ones are not. And we talk a lot about that in our open enrollment episode from last year. But you have to do the same thing with healthcare sharing. So it's not different. Just because these healthcare sharing services don't have to provide care like an insurance company doesn't mean they don't. You just have to be aware of what they do and do not. So the next question to ask is, can you lose your membership in a medical cost sharing plan? And the answer is yes. So each plan's guidelines spell out the rules for members. And if you don't meet those, again, it's mostly the lifestyle stuff, you can actually be dropped from a plan, it's a lot harder for insurance. Now, this points out that a lot, you can be dropped for religious reasons. That is very rare in these plans nowadays. Nobody really cares if what you're doing behind closed doors. I think I haven't looked up kind of what you can be dropped for on Liberty, but these plans do come with that stipulation. So that's another thing to be aware of.
Mm-hmm. Yeah, I think more often they just might not cover expenses over being dropped, but I would imagine it depends on how often you're submitting expenses that may not be in line with what you've already signed and agreed to not be engaging in. But haven't heard of it, but I guess it is possible. And then the last question to ask is just a series of questions. So here's some other ones that may or may not pertain to you, but worth considering if you're looking into these options, including: what are the plan's lifestyle rules? What are you going to have to sign? Can you, in good conscience, sign that? What will I have to pay out of pocket? What, if anything, does the plan guarantee it will cover? Will my doctor accept the plan? Is there any sort of network of providers? If I have a pre-existing condition, what are the rules for cost sharing? When I have doctor bills, does the plan pay them directly? Do I cover them and then the plan pays me back? What is that process? Because Jen's process with Liberty is different from my process with MediShare. So some of these healthcare sharing networks do approach that process differently. How do I appeal a sharing decision? And finally, how does the plan suspend a member's coverage? Like if it gets to that point, what does that look like? I'm sure there's plenty of other questions, but this is a really good start as you're considering what's going to be the best fit for you. And speaking of good fits, best fits, right fits, we got the fit for everybody. The Bill of the Week.
That's right. It's time for the best minute of your entire week. Maybe a baby was born and his name is William. Maybe you paid off your mortgage. Maybe your car died and you're happy to not have to pay that bill anymore. Duck Bills, Buffalo Bills, Bill Clinton. This is the Bill of the Week.
Hi guys, love the podcast. So I have had to tighten my budget recently and was looking around for ways I could save money. And I realized I was spending about $50 a month, not including tip, on my haircuts. I have a pretty short pixie cut, and so it has to be maintained pretty frequently. And I was going in for cuts about 4 weeks, maybe every 5 weeks if I could push it. And I was thinking about it and how I could save money. And I decided to take the step of shaving my head. And I gave myself a buzz cut at home in my bathroom, got my teenage daughter to help me. And it is something I've always kind of wanted to do, but never felt brave enough to try. And I realized that by shaving it all off, I could save $50 a month and rock an amazing buzz cut. My teenager loves it. She thinks it's the coolest thing ever. And I've been getting so many compliments and I actually love it. So that's my Bill of the Week. I no longer am spending $50+ a month on my haircuts because now I have an awesome buzz cut. Thanks.
Oh my gosh, and you have an awesome bonding time with your daughter who's helping to buzz it. I love it.
This is amazing. This is problem solving, outside of the box thinking. I love the choice that you made in this and how it was congruent with something you actually wanted. Like I could never tell somebody just shave your head to save money on haircuts, and that's like a quality financial decision for everybody. But the part that stood out to me was you saying you've always wanted to do this, but never felt brave enough. And this was kind of the push that you needed to cut costs in that way by cutting your own hair, becoming brave, loving it, bonding with your child. Like this is so amazing. I love the way that you've chosen to save by shaving.
I don't know what it is like in this time in our lives. Like so my friend Alina, she buzzed her hair, and that same thing. She said she's always wanted to do it and then just finally did it. And I mean, take charge. If this is something you thought about, like it is your time. The people are with you. I love it.
I'm on the opposite end of the spectrum by never cutting my hair.
That is where I am.
Grows and grows
One haircut.
and grows and grows.
One haircut a year. Mm-hmm. That's where I'm at.
Regardless of where you're at, if you've got a bill to submit to us, if it has to do with saving by shaving, budget cutting by cutting your own hair, or your name is Bill, whether or not you have hair, visit frugalfriendspodcast.com/bill. Leave us your bill. We can't wait.
We all agree that reducing carbon emissions is a good thing. And once again, Toyota is leading the way. We hear a lot about fully electric vehicles, and Toyota has them, with more on the way. But we also know a BEV is not for everyone, whether it's because of cost, range, or concern about finding a charging station when you need it. Plus, The raw materials used to manufacture batteries are limited. Enter Beyond Zero, Toyota's vision for a carbon-neutral future, in vehicles and in manufacturing plants too, in the years ahead. The materials used to make just one long-range battery for an EV could be used to make batteries for 6 plug-in hybrids or 90 gas-electric hybrids. That's why Toyota's position today is electrified, diversified, empowering you to choose how to reduce your own carbon footprint with the vehicle that's right for you. A hybrid, plug-in hybrid, or battery EV. So shop, learn more, and get details at toyota.com/Beyond Zero. Toyota, let's go places.
It's never too late. Never too late to earn a degree. Never too late for a comeback. Between your busy career and taking care of a family, it can feel like there's never a good time to go back to school. But your time is now. Time to start your comeback with Purdue Global. As Purdue's online university for working adults, Purdue Global is dedicated to supporting adults like you who know it's time to earn the recognition you deserve. You have the experience, you have the knowledge, it's time to get credit for the work you've done. You can balance work, family, and everything in between while earning your degree. It's time to move forward in your career, for your family and for yourself, with a degree you're proud of, a degree that employers will recognize and respect. You're worth this investment in yourself to earn a degree you deserve. It's never too late. Never too late to go back to school and come back stronger with an education you can trust. Now is the time for your comeback. Start yours today at purdueglobal.edu.
And now it's time for the lightning round.
Pew, pew. So for today's lightning round, so the question is like, would you recommend healthcare sharing? Why or why not? I don't think I can really say whether I recommend it because I don't know you. Like, I don't know the effort you're willing to put into like negotiating costs, self-care. Because some you can, if you get a bill and whatever you negotiate down, they'll take that part as part of your annual unshared amount. So if you are good at that and you want to do that, it's really cool. Like, it's really good for you. Sometimes it's not. I think for me, I can only speak for me and my family. It made sense for us because we don't go to the doctor often. We do not have any chronic healthcare conditions. We don't have any like mental health care conditions that we seek out, that we seek help for. We just like bury them down deep inside. Just kidding. We don't do that. So it made sense for us, right? And even when I had the opportunity for free insurance, obviously I took it. And then when that was taken away from me so rudely, then Travis and I just had insurance for a few years because it wasn't that expensive. And now that we have children, it's different. So you reevaluate every season in your life, right? So there was a while. So in Florida, under 4, kids can be on Medicaid, Medikids, and we don't get it for free. It's based on income, whether you get it for free or not, but you can still be on the plan and it's very inexpensive, even full price. So Kai was on Medikids for the first 4 years of your life, and both of us were on healthcare sharing, and that saved us money. So look at your state, county, city, whatever's programs for insurance. Compare it to some of the top healthcare sharing providers and see the options that you have for just saving a little bit. See what your options are, because it is a way to temper one of those fixed, quote unquote, fixed expenses that we all view as fixed, but can actually be creatively lowered. It's not right for everyone, but I have personally had a good experience with Liberty. We are not paid by them, but I just literally found out 10 seconds ago that anybody who signs up based on my referral, I could get a $150 gift card. So let me know if you let me know if you sign up. But yeah, I mean, and Liberty has like all of the, I mean, not all of, but a lot of the benefits that I would have used, that I would have assumed only traditional insurance had, like telehealth. There's free telehealth from Liberty. I just download an app and I have several times used their telehealth for free. And then they just call in my prescription and I go pick it up. They've got a like a good RX type of savings plan for prescriptions. They have a dental savings plan. They have one for eyewear. They even, I just found out, have discounts on LASIK, which I should have checked before I got LASIK.
Oopsies.
Right? But yeah, I really like it, and it's got a lot of the things I like. I, had a good experience with my maternity care. I got to use my doctor that I like. I got to stay in the hospital for the entire time that I was able to. I stayed an extra night and day than I did with Kai, because I wanted to get home with Kai. And with the second one, I was like, please keep me as long as I am able to stay. I never got, my mother-in-law said she stayed in the hospital 10 days after she had Travis. And I was like, what? Why? And now I get it. So yeah, and I didn't have to worry about any of those costs not being covered. So yeah, that's me.
Yeah, I would say similarly. It's definitely an individual choice and decision. You know yourself best. For me and Eric, affordability was the biggest piece and factor. Knowing that we're relatively healthy, we don't go to the doctors that often. What I primarily utilize the doctor for is, I've got a head cold or something else that I know what's going on. I can utilize the free telehealth. If a prescription's needed, they can call it in and just keep costs so low. So if you're in a similar position, then it could be worth it. Another benefit that we have through MediShare is that they will give additional discounts for healthy living. So beyond the whole like lifestyle thing that you have to sign, if you are willing to submit blood pressure, height, weight, you've kind of said, yes, we exercise, we live this healthy lifestyle, we're low risk for certain medical conditions, they give an even greater discount to your monthly share amount. So that's been a benefit to us as well. Two other things, though, that I will note didn't come up in these other articles that are worth considering if you are in this process of wondering what's best, is to look into the process of what it means to adjust your monthly share amount or adjust the equivalent of the deductible. When we first went on MediShare, I had a lower essentially annual deductible. Again, that's not what they call it, but it's what I'm going to call it for the sake of understanding. So we were at about maybe a $4,000 annual deductible. At one point when I was just kind of readjusting all of our bills and expenses and realizing that we've been on this plan for 6 to 8 years and we hardly ever use it, it didn't feel like the monthly amount was worth it for me for that lower deductible. So that's when I chose to increase it to the $10,000 deductible. More recently, I've been interested in decreasing that amount, but only then did I realize that it's quite a process to change it. I don't know if this would be the case for all types of sharing plans, but when I called, you have to incrementally drop down your annual deductible. So they could have dropped me down from $10,000 to $9,000 annually, which would increase my monthly. I'd have to wait 6 months before I could drop again. So if I'm starting at 10,000 and I want to see myself back at 5,000, I mean, we're talking years before I'm going to get there. And then I asked, well, then why would I not just cancel and restart? And they were saying, yes, you could do that. But like we said at the beginning of this episode, for many of these health sharing ministries, they won't start providing benefits to you until 6 months after signing up. So yes, I could drop them and re-become a member, but nothing would be covered for me or go towards my annual share amount until 6 months of being on the plan and paying monthly. So that's just worth stating. Make sure that you lock yourself in at a good annual deductible, because to change or to go to a lower level annual deductible might be quite a cumbersome process. I also have recently learned, at least with the sharing that we utilize with MediShare, that even with your annual deductible, it's not as if every medical expense you pay goes towards that annual deductible. Not everything is eligible for sharing. So you may pay out of pocket for care that doesn't even count towards your medical deductible. So one of the things that MediShare specifically doesn't cover is just like routine preventative care. So like a pap smear. If you're going for a pap smear, they're not going to cover it. And the amount that you pay towards a pap smear doesn't even count towards your deductible. So clearly not sponsored by them, because that's, in my estimation, that's not great. It's something I'm willing to do. I think overall annually, it is still less expensive for us than if I were to get on a traditional health insurance plan. But these are the things that are worth knowing before making the switch or signing up.
Yeah. Liberty, one of the reasons I chose Liberty was that they do cover like primary care, like yearly preventative. So you have to be on for at least 2 months. And then any annual preventative wellness visit and related lab work, for which there are like no symptoms or diagnoses in advance, are eligible for sharing up to a max of $400. But they do have some like unshared amounts per visit. So like a primary care doctor would just be $25. You'd have to pay $25 for that, and then like beyond it would be like that. And then they have unshared amounts for like the emergency room is $500, CT scans, MRIs $200, but that's very comparable to insurance too, those prices.
Mm-hmm.
But yeah, again, not sponsored by Liberty, but I've liked them. I mean, the only thing they say they explicitly will not share are things that are outside of their sharing guidelines. So again, like if you're taking illicit drugs and something happens, they don't cover anything related to results of, drug use or smoking. So
I believe
stuff like that. And then you
Liberty-
have to be on 6 consecutive months before they will share anything maternity related.
Okay. I have a couple of friends on Liberty, and I think with them, you have to be on a specific tier to get maternity covered. And that wasn't great for a friend recently. Whereas, so like for MediShare, for example, any tier you're on, medical care or maternity care is covered. But I believe it's Liberty. You have to select the one that would cover it. So they were in a position where they thought that they were covered, and then got pregnant, and then come to find out they weren't on the right tier of the medical share plan, and then couldn't switch, because you can't switch once you do become pregnant. So that wasn't a great experience for them. So it really is a matter of doing due diligence with this.
I'm looking at the maternity care, and it does say any of the programs are eligible.
So maybe it
now.
wasn't. You know what? Maybe it was CHM. Sorry, Liberty. It was CHM.
Any Unite, Liberty Connect, Essential, even the 18 to 29 or the 65 plus plans.
Oh,
I don't know why you would.
Yes, get it.
Just as long as you've been on 6 consecutive months. So yeah. I mean, so if this causes you to sign up for Liberty, you better reach out to me on Instagram so I can get that gift card. I'm just saying, if you're listening and this prompts you to do that, no shame, tell me so I can get a gift card. Because Liberty ain't paying me, except for they pay my medical expenses. Anyways, thank you so much for listening. We love, love, love reading your kind reviews. We especially love this one from Poison Blackberries. I love that name. And they say, great tips from great chicks. This is a wonderful podcast with helpful finance tips. Jen and Jill are so genuine and helpful, and I love hearing their open and honest personal perspective. They have a wide variety of topics, and their concept of the radical middle is so valuable and should be applied in all areas of life. So happy I found this podcast, and I enjoy the fun banter between the hosts. I love the recent story of Jill's pans and how she fixed them and returned the new set. Excited for your upcoming book.
Yay. I'm still wondering about those poison blackberries. No, that's just your name. That's amazing. Beautiful. And I'm glad that you enjoyed the story. Thanks so much for listening. If you all are listening and you are hearing this review and it's inspiring you to want to take a minute and leave a rating and a review, that is one of the best gifts you can give to us and others, because it helps potential new listeners know if this is going to be a good fit for them. So please go rate and review us.
Bye.
Frugal Friends is produced by Eric Sirianni.
With the best all-inclusive vacation deals to Mexico and the Caribbean, booking your getaway with Cheap Caribbean Vacations means you have more freedom to do your deal. Whether you want to enjoy snorkeling, endless margaritas and more, or simply soak up the sun and sand in a tropical paradise, Cheap Caribbean Vacations has your deal for that. Plan and book the exact getaway you want at exactly the right price for you by using our exclusive budget beach finder, or find a featured all-inclusive package to Iberostar Hotels and Resorts and do your deal at cheapcaribbean.com.
Bring home Napoleon.
Destiny has brought me here.
The action epic from acclaimed director Ridley Scott.
What is your name?
Napoleon. You are the greatest leader in the history of the world.
Witness the rise.
You are nothing without me.
Of the legend. Starring Academy Award winner Joaquin Phoenix and Vanessa Kirby.
I'm the first to admit when I make a mistake. I simply never do.
Napoleon. Buy or rent on digital now. Rated R.